My name is Irina. I'm a lecturer in child and adolescent mental health based at the Faculty of Nursing, Midwifery and Palliative Care at King's College, London. I have a long-standing interest in parental depression and the impact it has on child development. I'm particularly interested in understanding mechanisms that underlie adverse effects of parental depression on the child. In order to address this question, we used wearable head cameras that we asked parents and babies to wear at the same time at home when they engaged in their routine interactions, such as playtime and mealtime. Research on fathers and father-child interactions was done in parallel with Rebecca Pearson's work looking at mother-infant interactions. She was the one who pioneered this method in UK. We were collecting data on both mother and father-infant interactions in the even longitudinal study of parents and children, which is also known as ALSPAC. Our work established that head cameras are a feasible and acceptable way of recording parent-child interactions, and that they also pick up on more variability in parental behaviors. So, in line with family systems perspective, which is being increasingly advocated in research and clinical practice, we wanted to move away from collecting data on individual or dyadic parent-child interactions to collecting data on family interactions where the mother, the child, and the father interact together. So assessment of dyadic interactions is complex and ordinarily takes place in experimental settings. We developed a close collaboration with Professor Nicolas Fevas and his research group based at the Geneva University to combine the head cameras protocols with the low-zone trilog play paradigm so that we can collect observational data on triadic interactions in home settings using the wearable head cameras. We also wanted to explore how observations of family or triadic interactions can be translated into family-based interventions underpinned by evidence-based video feedback approaches, and how their uptake could be increased in clinical and community settings. Given the complexity of observational data, particularly on triadic family interactions, we wanted to understand how we can utilize artificial intelligence and machine learning computational algorithms to help us to code and analyze that data. We're extremely grateful to King's College Faculty of Nursing, Midwifery and Palliative Care for supporting us with seed-borne funding to address these questions in more details through a series of co-production and co-design workshops. Our first co-production workshop with 15 families aimed to co-design acceptable, accessible, and feasible protocols to measure triadic interactions using the LTP paradigm and wearable head cameras in participants' own homes. The second collaborative workshop with fellow family and health practitioners enabled us to co-design pathways and mechanisms for optimizing the uptake of family-based interventions in community and clinical practice. And our last interdisciplinary methodological workshop aimed to bring experts from different disciplines to co-design theory-driven artificial intelligence and machine learning protocols to analyze and code complex observational data on parent-child interactions. Using co-production and co-design methods enabled us to engage with families from diverse backgrounds to gain their input into the design of data collection protocols. Families were able to advise us on all aspects of study design, including detailed feedback on recruitment and data collection protocols. The project is still ongoing, but several important outputs are worth highlighting. First of all, the project has enabled us to collect invaluable pilot data that we will use to develop strong and competitive external funding application. Second, the project facilitated development of a strong and cohesive interdisciplinary team underpinned by national and international collaborations within and outside King's. We've also built strong partnerships with NHS trusts and community support groups for families, which will enable us to disseminate the research outputs directly to the families and also increase the impact of this research.